Okay, so this morning we're going to grab a couple of minutes with Ann Kirkpatrick, who works for Totalmobile, specifically in the health and social care side of the business. We're going to talk a little bit more about reablement services, because over the last 6 to 12 months, we've found that this has been an area of the health and social care market that we've had a lot of traction in, and an area of the market which is experiencing quite significant challenges, and again, an area of the market that we find that we're delivering quite a lot of value to. So we want to get a little bit more of a flavour around that, and there's no better person in the organisation to give us that than Anne herself. So Anne, thank you for spending some time with me this morning.
It's a pleasure, Simon.
I suppose just before we really get into it, I think it'd be really great to give those who are watching this a little bit of an insight into yourself, your role in the organisation, but I think really importantly your background, because there's a few interesting elements of that which make you particularly relevant in this particular space.
Okay, well, I've been with Totalmobile for a little over 5 years now, Simon, but don't know where the time goes. Previously to that, I was working as a transformation program manager in the NHS, but really I've worked with public sector organisations for most of my working career. Alongside that, I was fortunate enough to spend some time working with a mental health professional who had serious health conditions, and I was helping her navigate the social care sector and the reablement and the joined up health and social care. So I got a real taste for what it was like on the other side of the fence, really, as well.
Yeah, absolutely. And again, yourself having actually frontline experience, if you will, of transformation in the NHS, very much Totalmobile, we talk a lot about being able to complement our technology with a real understanding of the markets that we operate in. And you've been the other side of the fence. You've seen that. You've been responsible for introducing these transformation projects. So again, very, very valuable asset for us. So listen, let's talk about some of the work that we're doing within reablement services at this moment in time. As I said at the start, I think this is an area of the business which has really kind of grown quite significantly over the last 12 months. Talk us through some of the work that we're doing there and potentially some of the customers that we're currently working with.
Okay, well, we've got customers that span the whole country, literally from Cornwall up to Scotland. We've got a lot of social care customers up in Scotland delivering dom care services. We're Wales across to Suffolk, Suffolk County Council, who have recently gone live with their Home First reablement team. We cover a raft of different health and social care elements. So there's mental health, all aspects of community health, such as rehab. So we're not just in the reablement and dom care sector, really. That's the point, yeah. And we cover the whole operational side of the business, really, right through from rostering, scheduling and allocations, recording information about the care delivered to the service users, and also protecting employees with a lone worker solution.
Yeah, absolutely. I think whenever we look at reablement services itself, listen, it's no secret that there's challenges experienced right across the spectrum of health and social care services. But I think we've found that reablement is one area where these challenges are particularly significant right now. Could you maybe give me a little bit of an idea about some of the main obstacles that these service providers are facing on a day-to-day basis?
Yeah, well, it comes down to demand and capacity, really, doesn't it? It's those two things without a shadow of a doubt, and we hear it in the news all the time. So what the reablement services provide is the ability for people to be discharged from hospital as early as possible, because all the evidence suggests that people recover quicker and better if they can do it in their own home. And the reablement service plays a massive role in the flow of patients through the health service, from the ambulance waiting at the door. If the reablement service is able to accept someone who's ready to be discharged as really quickly, that frees up a bed for someone from the ambulance to come and be admitted into that hospital bed.
Yeah. So you mentioned it's about demand and capacity, but I also imagine that there's a strong element of the quality of care as well. So it's not just about freeing up capacity, freeing up hospital beds, but I imagine for the majority of patients, they prefer to recover in more comfortable surroundings of their own home, and that's what reablement services is allowing them to achieve, essentially.
Yeah, exactly. And there's a lot of evidence to show that they do recover better and quicker, when we are able to do so in our own home. People are living longer and with more serious conditions, and also there's the whole wear and tear part of that as well. So more people are requiring hospital care, and more people are requiring that care at home to get them into a good position following their recovery from a hospital episode.
Yeah. So again, yeah, absolutely a key service, and it does probably impact also other areas of the health and social care service as well. So for example, if reablement services is feeling or is experiencing challenges, that's more people being readmitted into hospital, which has knock-on effects across other areas of the whole health service.
Exactly.
Yeah.
And one of the demand, your capacity is, there's obviously the funding, which is one side of it, but the capacity in terms of the people, typically someone will come into the reablement service with, and typically it's a 6-week service. Some people are longer, some people are less, but if you're able to provide a really consistent, high quality service, you might get somebody back on their feet in 3 weeks, and then that's 3 weeks of capacity that's going back into the service.
Absolutely. So whenever you're sitting down with our customers in this space, and they're obviously talking to you about what they're trying to achieve, their ambitions and their objectives for the service itself, what are some of the things that you're hearing from them? What are their goals currently?
I think the important thing really is that they need to be able to do more with the same. So they need to be able to deliver more service with the same funding and the same staffing. But staffing is a significant issue as well, because the care industry isn't a high-paying industry, and the job is very stressful. So finding a way to make the job more enjoyable for staff so that you retain those staff. And we're back on that capacity topic again. So if you've got a stable, well qualified workforce, then those people are able to just focus on delivering care. Whereas if you've got a lot of vacancies and a high staff churn, you've got the recruitment exercise, but then you've also got the training of those people, and somebody has to pick up the work that those vacancies would otherwise be doing. So very much there's, as you said earlier, there's a sizable increase in the demand on us to provide digital solutions, so that we can work towards improving not only the service that's provided, but the quality of the job that people are doing, and the quality of life for those care workers, so that they stay in the job, and increase the capacities of the people who would be doing the training can now do their care activities.
Absolutely. So that brings me on nicely, I suppose, to just ask you a little bit about, the solution that we are providing within the reablement services space. Can you talk me through some of the key elements of that, and, how are we helping these service providers transform and improve the way that they're working, not just to help better deal with capacity and deliver better care, but you touched upon, I think it's a really interesting point, provide a better way of working for those frontline staff as well, who really do face the brunt of the challenge, really.
Yeah, they absolutely do. So I think the main thing that we do is we deal with most of the dead time. So by dead time, I mean people. So if you take a team of, say, 300 reablement workers, you'd have 4 or 5 people just dedicated to allocating the work to those people. So who are they going to see when? Has everybody who needs to be seen been given somebody to go and see them? Has everybody who's working been given enough work? And that's a full-time job. And then Mary phones in sick, and then we've got to rejiggle the whole thing again. So by dead time, I mean that time, because that's typically senior people who are really qualified in the industry. So they can, instead of spending all their time just doing that allocations process, their expertise will still be required, because there is always a human element at some point, but a significant portion of their time can be put into the actual delivery of care in the service. So that's an example. Other dead time is where the care workers are having to drive back and forth to pick up notes or drop off notes, or get information, sitting on the telephone to get information. We provide the information that they need on their mobile device, so they know where they're going. They've got the address, they've got the map, they've got all the information they need about that person. And that also then feeds into a consistency of care. So everybody arriving to look after you is arriving with the same information, the right information. And so it's just, that journey is so much more streamlined from who needs care, who's available to deliver that care, and then making sure the right people, and continuity of care as well. So you don't want a different, if you've got 3 visits a day, you're being visited 3 times a day, you don't want 3 different people turning up every single day in a week. That's 21 different, 21 strangers have been into your home. So you want, as far as possible, the same cohort of care workers coming in to look after you.
Yeah, I think one of the things I'm aware of the solution is it is a very comprehensive solution. It quite holistically deals with each stage of service delivery across Reablement. So it's something like the capacity checker. I can absolutely see value. Can you tell me a little bit about how Reablement service providers are able to benefit from the capacity checking functionality that we help them with?
Yeah, of course. And so one of the things about having a digital solution to support your business is that you've got really good quality data. So now we've got accessible in our system who needs care and what skills are required to deliver that care, who's working and what skills do they have, and what is the current workload. And now when a new referral comes into the service, and the hospital phones and says, Simon's ready to be discharged, you can put the care requirements in for that new person potentially that's coming into the service, and you can see the impact that it will have. Do you have the capacity with your existing staff, with your existing shift patterns, etc.? Or for example, maybe you can do most of it, but you can't do the morning visits unless you change your business. So it's giving you the ability to proactively assess the impact of incoming referrals and proactively manage the service so that you can increase perhaps the morning capacity, so that you can take on that service without a knock-on impact.
Yeah, you mentioned data there, and I think that's a fantastic point. And certainly as we look to the future, but also in the now, how we manage and utilize data very much is the key for continuous improvement in areas in service delivery such as this.
Yeah, absolutely. And digital transformation isn't a project that has a start and an end date. It has a start and it goes, because as exactly what you say, as your data, the longer you're operating on the digital platform, the richer your data is becoming. So the more you can use data-driven evidentiary decisions to drive your service, the operational delivery of your service. Yeah, absolutely.
And that's absolutely something that we very much support with. So I suppose finally, Anne, from me, let's look into the future. I imagine the challenges that are being faced across the health and social care space aren't disappearing anytime soon, unfortunately. But we're very much here to look to try and support that and help turn challenges into real areas of strength and drive improvement. What are some of the things that you're looking forward to and you're looking towards in the next 12 to 24 months, I suppose, about how Totalmobile are looking to operate in this space?
Okay, well, it's it's very busy. We've touched on that already. There's been a sizable increase in the demand for our solutions. So we've got lots of new customers to be onboarding. So that's the start of their digital transformation journey. But we've got a lot of customers on board already who will be going through that continuous improvement process. And we operate Totalmobile, as you know, we've got the customer success model. So all of our customers have a senior, experienced person available to them to support them to make the very most of the solutions that they do buy from us. That's not a chargeable service, and it's not a targeted service either. It is purely to support that long-term journey for customers. But in terms of digital, what does the future hold? I think CGI and Carmarthenshire is a very good example where they're moving towards delivering care when needed rather than in case. And so what that means to the service user is that instead of having 21 people intruding on their home when they don't actually need them to be there, those people are only coming when there is a requirement to, with all the home monitoring features in place. The alerts are sent off and people only attend when they need to. So again, we're back on that capacity. That's a huge capacity, but also for the citizen, the service user, it's so much less intrusive if you don't need those people to be coming to your home all the time.
Yeah, indeed. Fascinating. Well, listen, again, thank you for spending some time with me this morning, just to give a little bit of an insight into the work that we're doing in the reablement services space. Really fascinating, certainly a market that we're very proud to be helping, certainly a market we feel very passionate about. And, I look forward to seeing more of what we do in this area in the future. So thanks again, and I will speak to you soon.
Pleasure. Thanks, Simon.